Hello everyone. Today I am going to talk about autonomic nervous system and its related medications. The nervous system is divided into a central nervous system and peripheral nervous system. Central nervous system is composed of brain and spinal cord. Peripheral nervous system is composed of somatic nervous system and autonomic nervous system. Somatic nervous system is related to our voluntary activities. Autonomic nervous system is related to our involuntary activities. The autonomic nervous system is further divided into sympathetic nervous system and parasympathetic nervous system. So today I will be discussing with you the difference between sympathetic nervous system and parasympathetic nervous system and also related medication. The autonomic nervous system is divided into two: sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system is also called fight and flight, and these fibers are actually originated from the thoracolumbar region, and sympathetic nerve fibers are also called adrenergic fibers. The neurotransmitter secreted with the stimulation of sympathetic nervous system is adrenaline. The functions of sympathetic nervous system is it increases the heart rate and blood pressure, it dilates the bronchi and pupil, it constricts the blood vessels, decreases the saliva and peristaltic movements of the large intestine, and also decreases the activity of bladder. If we take an example, let's say there is a situation where there is a fire at home, or maybe there is an attacker inside the house. So what the person is going to do, they are going to run, right? When they are running, so that's what it is, a fight and flight. When they start running, their sympathetic nervous system gets stimulated and body secretes the adrenaline, and then what's going to happen? Because they are running, their heart rate and blood pressure is going to go higher. They want to breathe faster because they are running, so the bronchi will dilate so they can have more air. Their pupil will dilate. Just remember, if they have to run in a dark place, they really want to see clearly, so think of that. So their pupil will dilate, their blood vessels will constrict, and right now they don't want to eat anything because their adrenaline is in their body and they are not worried about eating right now. So their digestive system is going down. So it means they have a decreased saliva, their peristaltic movement of large intestine will decrease, and which may lead to constipation, and they are not worried about peeing right now. So their bladder will prevent contractions. So if you go to the parasympathetic nervous system, this is more of a feeding and breathing. So it's more of a digestion and resting. So if someone had a stress response, they had a stimulation of sympathetic nervous system, and after that the parasympathetic nervous system will kick in because now the person wants to eat and rest after that. So the parasympathetic nervous system is, these nerves are originated from the craniosacral region, and these nerves are also called cholinergic nerves, and the neurotransmitter which is secreted is a acetylcholine. The functions of parasympathetic nervous system is to decrease the heart rate and blood pressure, to constrict the bronchi and pupil, dilates blood vessel, increases saliva, because this system stimulates the digestion. So bile will be excreted, peristaltic movement will increase, peristaltic movement of large intestine will increase. Person may have a diarrhea at this situation, and person will like to pee, so the bladder will contract. So these symptoms of sympathetic and parasympathetic nervous system, they are opposite to each other. The medications on the left side will stimulate similar symptoms as sympathetic nervous system, but inhibit the symptoms of parasympathetic nervous system on opposite side. So on left side we have adrenergic, anticholinergic, sympathomimetic, parasympatholytic, acetylcholinesterase and cholinesterase. So these all medications produces the similar symptoms like sympathetic nervous system. Let's take an example of anticholinergic drugs. These drugs can be used to decrease the salivation or inhibit the parasympathetic influence. We should avoid anticholinergic drugs in a patient with constipation, and urinary retention. On the other hand, the cholinergic drugs are most often used for urinary retention because it contracts the bladder and person can pee, and is also used topically for glaucoma because it constricts the pupil. It can also stimulate salivation in a patient with xerostomia. Side effect of these medications will be the effects of parasympathetic symptoms, so it should be avoided with a respiratory disease. If you see here, it constricts the bronchi, and it should also be avoided in a patient with a bradycardia, or if they are prone to bradycardia, because it decreases the heart rate. So in a similar way, you can go over all the medication and you can see what their effects and what their side effects are. At the end, I will like you to do this quiz, and I hope you enjoyed my video, and thank you so much, and see you next time.